Hey everyone, welcome back to the Inflorescence podcast. My name is Bree, and today I am joined with Amanda. Amanda is going to be speaking on maternal mental health. Amanda is a mom of two and also a licensed counselor in New York. So we have a great and very important perspective here to share. It is personal and professional within the same breath, but I think it's important to preface as well that it's not a conversation coming from expertise or specialty in maternal mental health. I want to just share that this was an episode it's coming out in June, but it's an episode that was meant to be a part of a series on mental health for Mental Health Month. And due to just timing and scheduling, it didn't really turn out that way, but it's still so important for me to get this out there and have these conversations because it's pretty fitting right now. Discussions on maternal mental health and motherhood, it's very important to share, especially at the moment. So very happy and very excited to put this out there. And without further ado, I'm just gonna shift us right back into the core of the episode and allow Amanda to introduce herself and get right back into our conversation. Okay, so I'm here with Amanda. Amanda, if you'd like to, let everyone know a little bit about who you are and what we're going to be discussing today, we'll get started there.
Yeah, thank you so much. Thanks for having me. I'm excited. I'm Amanda. I am a licensed mental health counselor. I work in New York State, and I'm also the owner of Mindful Living Counseling and Consulting. I work as a trauma specialist and a clinician who specializes in working with emerging adults. So my niche area is in helping people that deal with transitions related to all phases of life. So that's really the scope of my work. And I'm here today to talk about maternal mental health in being a new mom to a second baby as of May 4th. So I'm happy to talk about this today with you.
Well, congratulations on being a mom to a second baby. That's awesome.
Thank you.
Very, very adorable. I love seeing the pictures.
Thanks.
So kind of, I haven't worked with maternal mental health. I know of it. I've read up on it. But it is rather, it's very specific. And it's very interesting on, how it affects individuals and the families of that individual as well. So kind of start out from more of a personal lens, kind of, leave that there, personal and professional, but we're coming from less of like an expertise in maternal mental health for this conversation. But what is maternal mental health to you? How is that defined?
Yeah, and I think that's an important place to start because I've had this discussion with a few other people before. I've done like lives with other individuals who specialize in maternal mental health and just getting their take on it from around the world, really. And among 11 developed nations, the US is is ranked the lowest in terms of maternal mental health care. And so I do have, I think, a unique perspective in being able to talk about it from a clinical perspective, but also like having lived experience with this. And I think a good place to start is looking at how the World Health Organization defines maternal mental health. So basically, they say that it's a state of well-being in which a mother realizes her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her community. So that's a very, I think, well-rounded discussion or definition rather. And it's looking at a lot of pieces. It's not just looking at mental illness, the presence of mental illness or the absence of mental illness or mood, but all of these other factors. And we know that all of these other factors contribute to mental well-being, especially for someone who is a new mom. The adjustment, that transition is huge. And to look at what our country provides or doesn't provide is a huge factor in that discussion. How our country supports women, mothers, parents in general, right? How they support parents in general during this transitionary period is I think, tremendous. So, there's that. When we talk about mental illness, there are several mental illness that we know can affect a person after they give birth. Even before they give birth, there's anxiety, depression. Of course, people hear of postpartum depression, postpartum anxiety, postpartum psychosis. All of these things are things that can impact a person after they give birth. But we do know that one of the main risk factors for developing something like postpartum is depression earlier in life. And right now, what we're facing with this spike in rates of depression and anxiety going up, we can anticipate that in years from now, the rates of postpartum and mental illness in women who are, who have given birth is going to also be much higher.
Yeah, definitely. And, discussions of, postpartum depression and what happens to women who are mothers after pregnancy or even during pregnancy. That tends to be kind of a new conversation that's happening. And though there is research and we do understand that there's plenty out there, there's still plenty more to be done. So that's still a developing topic for the world of mental health.
Yeah, I couldn't agree more. I mean, and I think we could say that about so many different pieces of mental health, right? We could have that discussion for days, but for sure, we know that to be true, that there's just so much to be done. And in resources, right? There are so many resources that have yet to be developed for women. But I think the thing that really afflicts new mothers, personally, I can say this, is shame and guilt. It really comes back to shame and guilt. And, for me personally, I know that in having a second child, the thing that I've been struggling with, full transparency, is guilt, right? Am I ruining my first child? She's gotten all of the attention. How is she going to receive this baby? Just anything and everything that you can imagine. And so there's that. And then to discuss that with people, that's where the shame comes in, right? Discussing this with people who seem so well adjusted, discussing this with mothers who seem like everything is seamless and perfect, and they are this like super mom, that's where the shame piece comes in. And I think that social media makes it that much more difficult, because what we see out there is everyone's highlight reel of being super mom and how things look. And even myself, I mean, I'm not often posting the very late nights or the sleepless nights, or just presenting that side of things. And so that's where I think the challenge comes in.
Definitely, there's that stigma of motherhood. As human beings in the world and throughout society, we do live behind these curtains. And as mothers with children, and this guilt and shame that you're mentioning, that curtain is so much thicker. So it's so much harder for us to see through it. But I respect you being able to be transparent and, name guilt and name shame as things that do come up for mothers, and even in your own personal experience. But I could imagine how that is worldwide for mothers.
Yeah, of course. And then the factor, like the World Health Organization defines, like they touch upon, being able to be well adjusted and contribute fruitfully to a community, right? Not just your family, but your community and in the workforce. Like, what does this mean for women who are also actively involved in the workforce? For me, this means putting my business on hold. That's my livelihood. Putting my career on hold, right? Putting it on hold. And I almost feel guilty saying that. I feel guilty saying that because obviously I'm taking a pause and putting that on hold for a very good reason, 2 very good reasons. Nonetheless, it's really hard for me because I've worked my, I don't know how I don't know how liberally I could talk here. I've worked my ass off, I've worked my ass off to get to where I am. Mm-hmm. And so it's really hard. It's a toss up. There are days that I'm like, I have this idea and I have that idea and I have this thing I want to attend to, and this networking event that I want to host or join, and I can't right now.
Mm-hmm. Mm-hmm.
So
Yeah. It's tough. And I could just imagine. And we talk about work-life balance so much in the field of mental health as well. And it's a form of self-care to say, you know what, my business has to be on hold right now because your family is there for you and you need to be there for your family. But most importantly, you need to be there for yourself. And that's this biggest topic is, putting work aside, putting things aside that aren't benefiting you so that you're able to benefit yourself is super important here.
yeah,
Awesome.
absolutely. And if you're not putting yourself first, just like with anything, right? If you're not putting yourself first, how much can you give to my career when I'm prepared to go back to work, or to my children, so that they can grow and be, well adapted, to my partner, how can I do that if I'm not putting myself first? So absolutely, I think it's
Yeah.
important to shed light on the idea of like self-care, and as cliche as that sounds, but for mothers, I think it's getting out of your head that self-care is your like daily shower, right? It's not
Mm-hmm.
your daily shower, it's
Yeah,
beyond that.
of course, self-care is this kind of now socially constructed idea of, like do your makeup routine or wash your face before you go to bed, make sure you're showering, that 5-10 minutes of time, when in reality we need much more than 5-10 minutes in order to get ourselves to where we want to be in terms of self-care. So
Absolutely.
really, yeah. One of the things that I wanted to get into was, I'm gonna make sure that I put the resources in and everything, but as I was looking at maternal mental health, some two major statistics were coming out for me that I was like, wow, which is that 1 in 5 mothers suffer from maternal mental health, and the other is that only less than 15 receive the treatment necessary.
Yes.
Right.
Yeah.
Shocking numbers there.
Yeah.
Mm-hmm.
And I think that goes back to the whole shame and guilt thing, right? The other thing is sleep deprivation is a tremendous part of early motherhood. Well, I shouldn't say early motherhood. I have a 2-year-old and she still doesn't sleep well. So there's been sleep deprivation for the last 2 years.
Mm-hmm.
But, sleep deprivation is a huge factor here. And so I think that's what contributes a lot to this. And it's like this haze, right? It's like this, haze that you're in, and you forget. I forget, right? I think I'm well resourced, I'm well connected, I'm a clinician myself, but this haze that comes over you definitely gives you the sense that you you know it's like you forget that you can reach out, you forget that there are resources available to you. So I think that in throughout pregnancy, the 9-10ish months of pregnancy, we're preparing for this little baby, and
Mm-hmm.
we're everything's about that baby, that child, but we forget about ourselves. So I have said to so many people, women that I've worked with through pregnancy, through the postpartum period, prepare for treating yourself, right? Get your resources in order beforehand so that you know what's available to you in your community. And it may not be a whole lot, unfortunately, but just getting that in order, thinking about your village, who is part of your village, who is part of your tribe that can really help you through that period, so that you can cling to them if you need the resources. But those numbers, I agree with you, are absolutely shocking. The fact that only 15% of women receive treatment that they need
Mm-hmm.
is staggering number.
Yeah.
Sick.
Yeah, totally. And you're talking about, having your resources kind of laid out for you before that's even necessary and before that's needed. And I think it's interesting that, women going into pregnant, like going into having a child, prior to birth, your entire doctor's visits and everything like that, you're coming up with a birth plan. That's put forth for you. You have this medical plan for all the possibilities that can come forward. And what's not discussed as openly is having the resources for the mental health plan as well that comes with it. It's mostly about the physical aspects of giving birth and having a child rather than the mental aspects of it as well.
Bree, I'll mention that the only thing that I received pertaining to mental health care or check-in was a form that I was asked to fill out at my pediatrician's office. So for my daughter's first visit, after she had been born, that asked about, it was almost like a PHQ-9, which you would know, so it's a depression scale, mainly depression scale, but it asked about, hallucinations, suicidal ideation, thoughts about hurting my other people, the baby, this sort of stuff. And it was a very brief questionnaire. It maybe took me 2 minutes to fill out. And they were just bubbles, and I would select them. There wasn't any place that I could add how I was feeling or what my experience was, or ask questions, or who I would direct my questions to. There was none of that. There was none of that in the hospital. And although I was so pleased with the health care that I received in the hospital, none of it was directed towards mental health or my mental health. And that to me was really sad. And, again, being somebody who knows that aspect of the healthcare system makes me feel extremely fortunate. I know about resources, but what about women who don't?
Mhm.
What about people who don't?
Mhm.
And it's a really scary thing. I always compare our country to Australia and their maternal mental health care system, because I think they have one of the best models in the world. I think Norway actually ranks #1 for maternal mental health care, or maternal care in general. But Australia, in my mind, I have a lot of family in Australia, so I can speak to that. Women there get a year of paid leave, and their job promised to them. They get aides to the home. They get several postpartum visits to check in not only on their physical health, but their mental health.
Mhm.
Um, they get so much support from their community, so many different resources, postpartum support groups, just so many different things that don't exist here. And I think that, it's important that we look to these other countries to think about what it is that women really need.
Mhm. Mhm. For sure. And there are, again, those models that we can see what that is and how that works. But in our country, it's very, you're going to have a kid. Okay. You have to work up until whenever you absolutely cannot. And
Yeah,
afterward, you have about a few weeks to get yourself settled until if you need stitches, till your stitches heal, until your body feels normal or, somewhat normal, that you're just right back to work. Right.
yeah,
It's expensive. It becomes really is a very big concern for, anyone thinking to have children right now. Well, what am I going to do for work, especially, us unfortunately going into a little bit of a recession here, inflation, everything happening in our country. It's so difficult to even consider having a child, not even thinking about the mental strain and a mental health here.
yeah, yeah. Thinking about the other things, like you're saying, like the financial strain, let's say, right? What does it mean financially to have a child now? But all of that we know plays into this definition of maternal mental health as the World Health Organization defines it, because there are these other stressors that we have to consider when you're considering other little humans,
Mhm.
right? When you're raising other little humans, of course, yeah, you have to think about the financial strain on your family. Can I financially support this little human? Can I give them the attention and the time that they need? So thinking about all these other things is really important. Um and and it, it's a tough time. It's definitely a tough time, and I do think that it's important that we look at these other models so that women can start to recognize, okay, this is what's available elsewhere. How can I make some of these things available to me here? And
Mhm.
if they're not available to me, how can I create it so that I'm in the best position possible to receive the treatment that I need and the care that I need,
Of course,
right?
of
It's
course.
time that we stop as mothers putting ourselves last.
Yeah, agreed. Right. It's very common for mothers to experience it in that way and say, you know what, I come last. My children come first, my family comes second, financial needs come third, and I'm absolute last on the list. It doesn't matter. As long as everything else is settled, I'll be fine. Which
Yeah.
it's very, it's misconstrued. It's not realistic, and it's very difficult to make sure everything else is great when you're not. So it
Yeah.
all comes back to this. And we're talking about treatment and these other countries and their models. So my last question for you, if we can get into it, is kind of what does treatment look like for maternal mental health? What are some resources that mothers could look out for?
uh, I would say that Well, number one, if you're feeling if you're questioning whether you could benefit from therapy or some kind of mental health care, then you should do it.
Right.
Jump on them, right? And so the first place to go would be, I always say to people, call your insurance company and get a resource list from them and look into providers in your area. Now, that's not always realistic. Not everyone has insurance. Some people have insurance. So many clinicians are not in network. Those are so many clinicians who may be in network have a tremendous wait list. It's not an easy process. And although it's easier said than done, try not to be defeated. Call so many people. Have family members and friends of yours. If you have family and friends, utilize them and ask them to pick up the phone and give them a few numbers and ask them to help contact someone for you. A good place to go is Psychology Today. You can filter it by so many different things, by specialties, by insurance providers, providers that take your insurance rather, by different areas and zip codes. So that's a nice place. Psychologytoday.com is where you can find vetted therapists. Every therapist that's advertised on there or who advertises on there has been approved or verified by Psychology Today. If you know anybody in the field, if you know anybody who's gotten treatment before, reach out to them. And in terms of resources that are available to women who are struggling in any capacity, particularly, moms in the postpartum period or during pregnancy, therapy is a really great place to start. Group therapy, individual therapy. I think what a lot of women don't recognize is that in having your own little humans, a lot of your inner child stuff comes up, and a lot comes up from your own childhood. So I personally do a lot of inner child work with my clients, being a trauma specialist. And so that work has been tremendous for women that I have worked with who have been transitioning to motherhood, because it's really just facing a lot of the stuff that you faced as a child, that you encountered or endured as a child, so that it's not being passed along to your children or coming up for you as you're parenting your own children. So therapy is a really powerful tool in preparing for motherhood. There are so many support groups. Again, you can find these online. I can speak to like Westchester, Putnam County in New York State. I know that there are a lot of great support groups there. One of my favorite places, can I shout out a place? Prana Prenatal Yoga is an awesome resource for parents. They do so many prep classes, birth prep, postpartum stuff, a lactation support group. You can pack up your lunch and bring your baby and eat with a bunch of moms in the park and vent and just enjoy some adult company and conversation. So they're a really awesome, powerful tribe for women. I think I've utilized a lot of their support, both during my pregnancy and postpartum. So that's really, I think, the way to go. Just like knowing that there's help out there for you. If you feel like you're struggling, reach out to someone. Even if just anyone, reach out to somebody who you feel you can confide in. And like you said, you're going to be posting resources. So I think absolutely, if anyone is struggling, turn to those resources and see what is available around you.
Of course. Yes. Thank you, Amanda, so much for being transparent and coming on here and sharing your knowledge on maternal mental health and having this conversation with me. It's been a pleasure.
Thank you so much for having me. I really appreciate you.
No problem. Thank you. Thank you all so much for listening. I'd just like to share my gratitude once more for Amanda for coming on and sharing, her personal experience with maternal mental health, coming from, the standpoint of someone with the professional understanding of mental health in general. I think it really shows how much we're failing, moms, and how much we're not, doing as much as we can, that when I say our, I mean as a country, that the resources are not available and it's very difficult to find them. And I just like to highlight that by saying, as I was trying to find resources to share with everyone, it was hard. Not even, looking specifically in New York State, could I find something that would be beneficial to share. There are small, like Amanda mentioned, um, one place that she shouted out, but there are some places where you can go that are very specific to mental health for moms and for postpartum. Um, but it's still difficult. So, as Amanda said, a way that you can kind of look out for help and try to find the resources available to you locally is to contact your insurance network on Psychology Today to find um, verified counselors and people who are able to help with specific needs in maternal mental health. And though I wasn't able to find very much information or very much resources, I would like to kind of plug in a national maternal mental health hotline that I came across. Um, it's a 24/7 free and confidential hotline for pregnant and new moms. I would just kind of like to offer a little bit of a summary of what the hotline does. So again, they're 24/7 and free. They're confidential, and they offer support for before, during, and after pregnancy. Um, if you were to call a hotline, some stuff that they offer, they state to offer phone or text access to professional counselors, real-time support, quick responses, 24/7 availability. They're also able to offer resources and referrals to local or telehealth providers and support groups. They claim to be culturally sensitive, which I think is super important when, we're talking on a national scale, is, understanding that motherhood looks different for everyone and it's very personal. They have counselors who speak English and Spanish, but offer interpretive services in 60 languages. So that's kind of a very broad um, resource that I can offer that has the potential to send you to somewhere very specific and very local to you. So that hotline is 1-8339 HELP for moms. That's 1-8339 HELP for MOMS. That's a 1-833-943-5746. And you'll also find the number down in the description of this episode for anyone who may want to just write it down, or if anyone listening would need it. Thank you again for listening. Thank you so much again to Amanda, and I'll speak to you all next time.